Hello everyone and happy Friday. This is Lindsay Vaughn helping with this week's CNO update. We're going to start by meeting a couple of our quality staff members, and then we'll finish today's CNO update with a message from Nan. So today we have Gail Dunlap, our CV quality coordinator, and Johnny Bernicke, our stroke coordinator here today. And so Gail, why don't you tell us a little bit about your role and how you help the hospital?
I'm the CV quality coordinator for the hospital. That means I do all things cardiac. I manage the registry, the data collections, and I monitor all the STEMIs and non-STEMI patients. And what I'd like you to know is that there's a heart icon on all of the computers, that if you have questions about how to take care of patients, our clinical practice guidelines, some of our algorithms, that is located on the heart icon, and you can always go toward that. If you don't get your answers there, you can give me a call at 5536 and I can answer the majority of your questions for you. Thanks.
Thanks, Gail. We appreciate you. And we'll turn it over to Johnny now, who's going to talk to us about stroke.
Hi, I'm Johnny Bernicke. I'm your stroke coordinator. And I also have a pink brain icon on your desktop. It has all things stroke on there. Anything you want to know from forms to procedures. And there's two cute videos at the very bottom. So let me know if you need me. I am on mobile and I do round every day up on the floors and in ICU and ED. So let me know if you need anything, and don't forget to hit like on the video. We get educational points. Have a great weekend.
Thank you, our quality team members. And now we're going to turn it over to Nan.
Couple other things I want to talk to you all about this week for the CNO update. Pathways. So pathways standard number 2 is on leadership. And a lot of the questions are around how visible is your manager, how visible is your director, how do you access to them, how do they help you with scheduling arrangements, how do they help you get to unit practice councils or staff meetings. One of the other questions is your CNO accessible to you? So I want to tell you some of the things that I do so that hopefully you know I am always accessible to you. Before COVID, we did Cup of Joe with the CNO. So we would have a quarterly kind of coffee, come and just tell me how things are going, kind of like a meet and greet. But post-COVID, we're not able to do that. So right now what I've been doing, the Walk in Your World, I did ER a couple weeks ago. So spending time on each of the units, just shadowing you, seeing all of the things that you guys are doing each and every day. These videos are another way that we're trying to make me accessible to you, just so you, again, can have a name and a face. And I want you always to know that my door is open. I've met with many of the nurses who want to talk to me about career advice or what should I be thinking about from going back to school standpoint. And one of the best things that I get to do is talk to you all about kind of what's next for you, what are next steps. And I am always available for any of those things, as well as if things aren't going well and you don't feel like you can take it to your frontline leader, you can always come to me about those issues. So we also do night rounding, weekend rounding. We'll be bringing the Pathways card around again. So that the fact that I am accessible to you guys, I want you to know, I can't stress it enough. It is the most important thing that I can do. So if I'm not out seeing you, please reach out to me and know that you always can. My door is open. Call me, text me, email me anytime. A couple of other updates. We have been very, very busy this past week, as you all know, holding in the ER. The inpatient side is kind of stressed and stretched again. We have hired 10 new what we call patient safety attendants, so they will be able to take the place of our sitters. So the techs that we've hired, the PCTs, will be able to stay on their units, and these PSAs will be able to work with us as sitters. So that's one thing that's coming. I think half of them start this next Monday, March 1st. And then there'll be more coming the 2 weeks after that. In addition, we had a group of STAR RNs start on the floors this week, and we've got another group coming next week. So help is coming. I know it has been a very stressful time as far as feeling like you're short and not having enough nurses. So we've hired as quickly and as safely as we can. So I want you to know that as well. Stay tuned for more Pathways updates. We're going to be doing this every week. Your leader should be sending those out. If you ever have any questions, know that you can reach out to me. Thank you.